I'm Kate Ryans. I'm an anesthesiologist, and I've been with Humber since 2009. At the time of the transition to the new Humber, I was the chief of anesthesia for 3 years, and then luckily stepped back into a regular anesthesiologist role after that. Day to day, usually I'm working in the operating room or in the endoscopy suite or on labor and delivery, providing anesthetic services, nerve blocks, general anesthesia, working with everyone from babies as young as 1 year old to elderly patients over the age of 100. And I work in the consult clinic as well. I'm doing anesthetic consultation for patients prior to surgery to go over their medical history and let them know what's awaiting them when they come to the operating room. So the physician care provider model is a model that was put in place last year at the height of what I think was the third wave, when there were so many patients in the intensive care unit with COVID that the system was overwhelmed and we didn't have enough critical care nurses to take care of them. And at that time, Dr. Avramescu and Dr. Hagan, I think, worked to set up this physician provider model where a few of us were trained to help out working in the ICU, to function as nurses and look after patients there, providing complete nursing care with the assistance, of course, of the nurses who work there on a regular basis. So we do everything that a regular nurse does, all of the documentation, all of the physical care, running the infusions, changing medications, suctioning, hygiene, communicating with families and with the physicians and other nurses and team members. So it's been very interesting. For the most part, it's been a very positive experience, or I wouldn't have picked up as many shifts there as I have. I'm kind of surprised that not more of us stepped into the role or continued doing it, because it's a pretty rewarding atmosphere to work in, looking after one patient for a prolonged period of time versus looking after potentially 8 or more patients even in a day in the anesthesia world. It's very interesting to get to see the other side of things as a nurse and see what they have to do on a daily basis, all the things they have to deal with, what challenges there can be when care is not taken with orders that are input. So you're in the room with the patient every hour on the hour giving a different medication rather than having things clustered together. It's been interesting to see how challenging it is working with all the PPE and having to put stuff on with pretty much every patient that you're looking after. So every time you go in the room, you're donning the gown, putting your face shield back on, putting gloves on, doing what you need to do, taking it all off, and then if the pump starts to beat up again a couple minutes later, you have to put it all back on again to deal with something that's just happened right after you left, which has been a challenge. Some of the physical care tasks, I think, were not very palatable to a lot of the physicians, so not all that many people were super keen to do the physical hygiene, which can be challenging with some of the patients, especially when they're prone with COVID. It's been interesting to see the range of patients that they have, to work with all the other members of the team. The nurses have been extremely supportive of the role. They're really helpful and have taught me a lot over the many shifts that I've done there. Hopefully I'm pretty good. I think I'm reasonably independent, but every now and again something still comes up that I need some assistance with, and they're always willing to help out. It's been great to see how much of a team they are together too, with everyone jumping in to help if a patient suddenly needs intubation or decompensates, or someone arrests, or someone's passed away and they need to prepare the body to go to the morgue. They're all immediately there helping each other out in a really collegial fashion, despite the fact that they must be so exhausted after doing this for 2 years running. And I know they're all burnt out and tired, and still they somehow keep on going, which is why I've really been glad to be able to help them in that role as well. It was really great last week to be able to give one of the patients the first shampoo that she'd had in 4 months in hospital, and brush her hair. And then I told her about my experiences as a COVID hairdresser at home with my husband and my daughter and my mother, who I've been cutting hair for the last 2 years. And she decided to take a chance on me, so I got to borrow the scissors from the desk on the east and give her her first haircut in 4 months, and my bed bath, and a little loofah with a face cloth, and she felt like a new woman after doing that, and being able to get rid of her nasogastric tube the same day and move on to eating real food again. So it was like a very rewarding experience to be able to provide some comfort and make someone have a bit more normalcy back in their life and give them a fresh outlook. So she was super happy for the first time in a long time. She'd been really nervous about her swallow study and passed that with flying colors, and then we decided to celebrate with a little beauty routine in the afternoon, and it was a big lift to the spirits for her and a lot of fun for me to do as well. I think my experience in the ICU through all of this has been the importance of all the personal protective equipment that we've had, and that I've been really grateful that the hospital has been able to access it and provide it for us, and has also been allowing people to wear their own respirators if they didn't have an N95 mask that fit, and have been pretty consistent at providing suitable N95s for us to wear, because I know not all hospitals have been as good about that as Humber has been. So that's been a really great thing to be a part of here, that they've really looked after staff safety as well as the patients. And then it's also brought home to me still more the critical importance of people being vaccinated and getting children vaccinated as well to protect their elderly grandparents or older parents at home, because a lot of the patients that they've had in the ICU with this wave in particular are elderly, unvaccinated patients, most of whom are not surviving, and otherwise there are patients who are immunocompromised who may have only had 2 doses of the vaccine or being unvaccinated. It's been very sad to see people dying unnecessarily from this disease and putting great strain on the healthcare system at the same time.